Hi everyone, welcome back to my YouTube channel. Hope you all are doing well. Today I will be talking about CDC strategies to prevent C-Diff infection in acute care facilities. This video provides information on the basic principles and interventions recommended for the prevention of Clostridioides, formerly known as Clostridium difficile infection or CDI in acute care facilities. The strategies are intended to facilitate implementation of CDI prevention efforts by state and local health departments, quality improvement organizations, hospital associations, and healthcare facilities. Core strategies for the prevention of C. diff infection in acute care facilities include: number one on the list is isolate and initiate contact precautions for suspected or confirmed CDI. Create nurse-driven protocols to facilitate rapid isolation of patients with suspected or confirmed CDI. The nurse-driven protocols can be immediately initiated by bedside nurse to allow isolation of patients with suspected or confirmed CDI. For suspected patients, ensure rapid evaluation by healthcare personnel and infection prevention. Place symptomatic patients or patients with clinically significant unexplained diarrhea on contact precautions in a single patient room with a dedicated toilet. If single patient rooms are not available, room patients with confirmed CDI together. For patients with confirmed CDI, maintain contact precautions for at least 48 hours after diarrhea has resolved or longer up to the duration of hospitalization. Infection control measures should be maintained for patients with EIA positive test result as well as for those with EIA negative but PCR positive test result. Adhere to recommended hand hygiene practices. Use dedicated patient care equipment such as blood pressure cuffs, stethoscopes, etc. Implement daily patient bathing or showering with soap and water. When transferring patients, notify receiving wards or facilities about the patient's CDI status so contact precautions are maintained at the patient's new location. Confirm CDI in patients. Clinical personnel need to assess for appropriateness of testing. Consider other infectious or non-infectious causes of diarrhea before testing for CDI. Non-infectious causes of diarrhea include inflammatory bowel disease and therapies such as enteral tube feeding, intensive cancer chemotherapy, or laxatives. Discontinue laxatives and wait for at least 48 hours before testing if still symptomatic. Once a patient has a positive CDI test, do not repeat testing to detect cure. Tests may remain positive for 6 weeks or more than 6 weeks. Laboratory personnel. Implement laboratory procedures to ensure testing of only appropriate specimens, example, unformed stool for C. difficile or its toxins. Report test results immediately to clinical care providers and infection control personnel through reliable means, for example, a laboratory alert system. Perform environmental cleaning to prevent C. diff infection. Create daily and terminal cleaning protocols and checklists for patient care areas and equipment. Perform daily cleaning of CDI patient rooms using a C. difficile sporicidal agent or EPA List K agent. EPA stands for Environmental Protection Agency. Clean and disinfect the patient care environment, including the immediate vicinity around a CDI patient and high-touch surfaces, at least once a day, including toilets. Clean and disinfect all shared equipment prior to use with another patient, for example, wheelchairs, gurneys, etc. Perform terminal cleaning after CDI patient transfer or discharge with a C. difficile sporicidal agent or EPA List K agent. As I mentioned before, EPA stands for Environmental Protection Agency. Clean additional areas that are contaminated during transient visits by patients with suspected or confirmed CDI, for example, radiology, emergency departments, physical therapy with a C. difficile sporicidal agent or EPA List K agent. Develop infrastructure to support CDI prevention. Incorporate reduction of CDI into the facility healthcare associated infection prevention program. Include a multidisciplinary work group including nursing, environmental services, and antibiotic stewardship to identify and implement strategies and to follow results of interventions. Monitor facility CDI rates and target units with highest incidence of CDI for evaluation and intervention. Review individual CDI episodes to assess for modifiable CDI risk factors including clinical management decisions, for example, use of high-risk antibiotics and gaps in infection control measures. Educate and train healthcare personnel on prevention practices for C. diff infection. Routinely audit adherence to hand hygiene and contact precautions. Routinely audit adequacy of room cleaning using methods described in options for evaluating environments cleaning. If you want to read about these options, I have provided the link at the bottom of this slide. Provide CDI rates to senior leadership, clinical providers, laboratory personnel, environmental services, and other stakeholders. Notify appropriate individuals and facility departments about changes in the incidence or frequency, complications including recurrences, or severity of CDI. Engage the facility antibiotic stewardship program. Implement the 7 core elements of hospital antibiotic stewardship. If you want to read about what those 7 core elements are, I have provided the link in the bottom of this slide. Assess the appropriateness of prescribing antibiotics that pose the highest risk for C. diff infection, especially fluoroquinolones and third and fourth generation cephalosporins. Develop facility-specific treatment recommendations for common infections that include first and second line antibiotics. Evaluate antibiotic treatment of conditions that commonly lead to high-risk antibiotic use such as asymptomatic bacteriuria and common infections such as urinary tract infection and community-acquired pneumonia to minimize the use of high-risk antibiotics. Ensure that patients receive the shortest effective duration of antibiotic therapy. Include inpatient antibiotic duration when determining post-discharge antibiotic duration. The links that are present at the bottom of the 2 slides in the video for options for evaluating environments cleaning and 7 core elements of hospital antibiotic stewardship are also present in the description box below. Hope you found this information helpful. Please consider subscribing to my channel. Thank you for joining me today. Bye now.